Hello, ladies and gentlemen. My name is Dr. Christoph Sippel. I'm one of the fellows of Professor Joachim Oertel, and today we do a quick interview about some questions regarding neurosurgery, neurosurgical training, and all the stuff around.
Yeah, my name is Dr. Oertel. I'm Professor of Neurosurgery at the Saarland University in Germany, and it's a pleasure to give you my thoughts about neurosurgery and neurosurgical development in the future.
Thank you.
What are your questions?
Yeah, Joachim, I have some questions for you. So first, why did you choose neurosurgery as a profession?
Well, neurosurgery. Actually, it was by accident. I thought I would become a general surgeon, and then I, got in contact with the neurosurgery, and I think it's the most sophisticated surgical discipline. So we have very delicate procedures, dealing with vessels on an almost molecular level. And then we also have big spine procedures where we do basically make a new spine. So I think neurosurgery is by far the most interesting surgical discipline.
Okay, and can you tell us something about some of your mentors during your residency time and your trainingship in neurosurgery in general and spine surgery in particular?
Well, I had the pleasure to work with a lot of different, very well-known and experienced neurosurgeons. So I started actually my neurosurgical career with Professor Sami in Hanover, and I really learned a lot about his thoughts and his ideas, and he really coined me to some degree to do for particular skull-based surgery. And then I had the opportunity to work with Professor Garb, and he basically was my boss well, he still is my boss to some degree. So he really made a lot of effort to make me a good neurosurgeon. Not always very pleasant, but with at least some force and some effect. And he taught me a lot about indication, surgical techniques, the idea how to avoid complications, and particularly endoscopic procedures. And then later, when I became the vice chairman of the department in Mainz, I had the pleasure to meet Bernetsky for his last months, and also got his ideas about minimally invasive techniques.
So these three big names you would name when you call them. Okay. Yeah, you just mentioned also some endoscopic procedures, and there would my next questions be addressed to. What do you think about training residents in endoscopic procedures during their residency, or do you think that should be reserved for a special fellowship training after all?
Well, I think now we are one step further than 10, 20 years ago. 10, 20 years ago, the endoscopic procedures were still to some degree experimental. So we had a high risk of complications. The success rate was not very obvious, but now we have some distinct endoscopic procedures we really need to teach the residents. I think, for example, ETV in obstructive hydrocephalus, for example, endoscopic application in the endonasal skull-base approaches, and for example, to some degree, endoscopic spine procedures, simple decompression. I think at least the residents need the experience to know the technique and to be familiar with the technique. You can discuss that they don't have to do maybe 100 cases during residency, I agree, but I think they should know the techniques and should be able to identify strengths and disadvantages of the different techniques.
Okay. And if there now comes a new applicant for a residency to you, what would you recommend him when he says to you that he wants to be trained in neurosurgery and spine surgery in particular? What hand would you give him on the way?
Well, in my experience, it's important to get the anatomy. You have to know the anatomy. Then the next step is to be familiar with the procedures. And when you have done this, today we do all about YouTube. It's not about books, but I think you have to know the anatomy, and then you have to know the procedure. And the third step is to see the procedure and to be the assistant in these procedures. And not only one time, maybe 3, 4, 5 times. And when you have done all this, then the next step is to do it yourself. And when you have done quite a number and you're experienced, then you can start to teach one. I think today we have the problem that frequently residents think that they start with a procedure on their own responsibility without really knowing the procedure, knowing the anatomy, knowing the risks and advantages and disadvantages of the individual technique. And I think this is it's mandatory, because later on you're alone. It's always only you. There's nobody you can call.
Okay, yeah. And what would you recommend the same resident when he comes to you and has some questions regarding research? For example, clinical research on the spine topic, as well as, let's say, stem cell research on the other hand in wet lab techniques. What would you recommend him when he's also addressing a research career parallel to the clinical?
Well, that's a difficult question, because it depends a lot on the environment, on the academic environment in the individual setting. So in my experience and in my opinion, I think that the most important part is research that you can translate to the clinical application. So it should not be too far away from the clinical application. So basically, you develop new techniques, you develop new systems. This is a good thing, that's an important thing. You develop new applications, new drugs, like stem cell grafts. If you really think that this is an indication which can be translated to the clinical application very soon, I think it's a good thing. If it's not very soon, so if it's rather basic research, I think it's not helpful to become a good neuro or spine surgeon to do too much basic research. This is sometimes different in different settings. So there are also settings where you do a lot of basic research, and then you have basically two different careers. It depends on your own interests, but to become a good surgeon, if this is the final goal of your interest, then I think it should be rather close to the clinical application.
Okay. Yeah, well, we also both had the great opportunity to work at the new guidelines of the WFNS spine committee recommendations for spine surgery. So switching to that topic, what do you think about our guidelines, and do you think they are helpful in general, and should there be some uniformity throughout the world regarding such guidelines? What do you think about that?
Well, to make a consensus statement for the World Federation of Neurosurgical Societies is a challenging task. Why is it a challenging task? Because the WFNS, the society, represents all societies of the world. So that means those who have no X-ray, who have no microscope, should also be included, and those who have all the sophisticated 1 million microscopes, exoscopes, whatever, navigation in their OR at hand. So I think it's a very, very challenging task to make a recommendation where you really include everybody throughout the world. I think it's a very important part. I think it's very good, because then we really we clean out what is rubbish and what is really evidence-based. So I think this is important. I think it's important to get an idea of what is common sense. For the application itself in the individual setting, it can help you, but it will not actually be the guideline you have to adhere very tightly in your individual setting. For this, it's too general.
Okay, very well. And as this is one of the later steps we did in the WFNS, what do you think about the progress in general the spinal committee is doing during the last few years?
The spine committee, in my awareness, it has always been a very active committee. And when you look back for the last 3, 4, 5 years, there are so many meetings, so many educational activities, and so many consensus statements out there now. I think it's at least from my perspective, one of the most active committees in the WFNS.
Okay, yeah, I had the same feeling. Is there any question I missed and you would like to address in particular, or do you think we have covered the most basic things now?
Well, I think the first statement is neurosurgery is the most interesting discipline. And second, if you want to go on neurosurgery, I think you should try to incorporate some research with clinical application.
Joachim, thank you very much for your time. I hope it was also quite interesting for the audience, and all the best.